Professor Lily Xiao is an internationally recognized dementia caregiving researcher. Professor Xiao's research field includes dementia care, cross-cultural care, workforce development in aged care, and chronic disease management for older people. She holds a Matthew Flinders Professor Award at Flinders University.
In this session, I will briefly discuss the research evidence on challenges in cross-cultural communication in aged care settings and cross and residential aged care and community aged care, and the best practice in cross-cultural communication reported in the literature, and the resources we have always developed to support aged care staff to use to apply to this situation. In terms of the research evidence on challenges in the cross-cultural communication, let's have a look some stats. Cultural and linguistic diversity from your organizations. However, the percentage of the staff and the clients from the code backgrounds may different from one organization to another. And on the national average, and we know about 1/3 of aged care clients and 1/3 of direct care staff were born overseas, and most of them came from non-English speaking countries. So that's the recent stats. However, the countries of the birth between the staff and the clients do not always match. The majority of the overseas born clients came from European countries, while the majority of the overseas born staff came from South Asian and the African regions. The most mentioned challenges is to communicate with clients or clients' family members to identify clients' care needs and the appropriate ways or approaches to meet their care needs. The first example I showed on the slides and is from the research projects. They reported the first one from Australia and the second one from Norway. The challenges when they talk to the residents and to identify the care needs. From the first one, from the residents, they have to be patient to talk to the staff to allow them to understand what they want and what they need and their preference. The second one is from the staff. They talk about the challenges they are facing to understand what the clients talked to them. In our multicultural society, care workers from the mainstream culture also face the challenges in identifying care needs and preference from clients from the code backgrounds. In the first example, the care home had residents from the Vietnamese background, but had no care workers from the same culture background. The second example is from an interview with a code resident's family member who observed the staff residents' cross-cultural communication difficulties. So the second one is from a research project from Canada, which showed the very similar cultural and linguistic diversity there. We all know that high-quality care is built on the meaningful interactions between care workers and the clients. And the care workers have responsibilities to engage clients meaningfully in daily care activities. This example on the slides shows that cross-cultural communication challenges also affect care workers' performance in interactions with clients from code backgrounds. Such situations contribute to the feeling of the loneliness in the care homes, although the residents, they had a staff and another fellow residents allowed them. They still feel loneliness. Those two examples indicate that communication challenges in care works affect clients' satisfaction with the services. And again, this example indicated that personal care assistants spent most of the time with clients, but contributed very little to the care planning. They usually they use the words by mouth to pass the information from one to another about the clients. However, they really engaged the communication with the whole entire team in the vicinity to allow all the team members to be aware of the situations in the vicinity. And this example shows that personal care assistants use the written notes to show residents' care needs and pass the notes to the staff in the next shift. This is a very good strategy and to allow the staff in the next shift to understand what was happening and how to take care of the residents in the next shift. However, as I mentioned before, there is limitations to use this sort of the communication with only few and staff. All the activities, care activities, is delivered through the entire team. So the communication strategies must help the staff to reach the entire team in order to deliver the team approach to achieve the high quality care for the residents or the clients. So far, we have seen some examples from cross-cultural communication challenges. We now have a look at the best practice in cross-cultural communication in aged care settings, again, reported in the literature. This example shows that leading by example in the leadership and management group is an opportunity to enable the multicultural team to cope with challenges. Provide timely support to staff to resolve issues they face is crucial to contain the issues and minimize the negative impact the issue has on staff, clients, and the families. In other words, the management and the leadership group need to make themselves available and accessible for staff who experience cross-cultural care challenges. This example indicates that getting to know other in the multicultural team is an opportunity to improve the team cohesion. The staff usually come from different countries. They need to know each other to understand each other. And this example shows that recognizing and utilizing cultural and language skills in the multicultural team are opportunities to improve care for clients and reduce work-related stress for members in the multicultural team. And this example indeed is from Australia, aged care. More examples about recognizing and utilizing cultural and language skills existed in the multicultural team. I'm very interested to hear about from you about how to use our multicultural team's strength to address the challenges later. And this example shows peer mentoring and peer coaching actually happened in the workplace, and it's an opportunity to help new staff to adapt into the work environment. And again, this example is from Australia, aged care setting. And this example indicates that collections with code communities are opportunities for staff to know their clients and to improve their cross-cultural interactions with clients. They mention about the on-site church and from some of the ethno-specific aged care homes. And the partnership with clients' family members are opportunities for the multicultural team to identify and meet clients' care needs and preference in cross-cultural communication and care. So those two examples are from overseas and from systematic review as well. And so far, we have identified challenges the multicultural aged care workforce face. We have also identified opportunities that aged care organizations need to take to enable the workforce to cope with those challenges. However, implementing the evidence-based practices to the organization's context is not easier due to staff shortage and the lack of resources in the sector. I believe that each aged care organization is unique and has different needs in the workplace, in the workforce development. Therefore, I encourage you to think about your situation and to work with your stakeholders to decide which opportunities you would like to take and how to implement those, we mentioned evidence-based practices in your workplace. And I have had the privilege of leading multidisciplinary teams across universities and the aged care sector to develop evidence-based cross-cultural communication resources for aged care staff. I'm going to introduce those resources to you if you are not aware. We developed the resources to support the implementation of the multicultural workforce model in the previous project. Those resources are described in the open access book entitled Multicultural Workforce Development Model and the Resources in Aged Care, as I showed on the slides. The resources include a web-based cross-cultural care program for aged care staff, e-books in PDF document, including cross-cultural program for aged care staff, facilitators menu and the staff workbook. If you Google those titles, you get the access to those resources through the links. The cross-cultural care program for aged care staff includes 5 modules. The module 1 is described as the introduction to cross-cultural care for new staff. It's suitable for new staff, particularly the new migrants. They just arrived in Australia. And the module 2 is about cross-cultural communication. And this module detailed the cross-cultural communication competencies to work with the staff and the clients. And the module 3 is about cross-cultural leadership. It's suitable for people in the management and the leadership position and the team leaders as well. And the module 4 is about the cross-cultural dementia care. Module 5 is about the cross-cultural end-of-life care. And we all know the spirituality and the religious beliefs affect people's expectations for the end-of-life care. So this module help the workforce and the staff to understand how to meet the care needs during the end-of-life care. We also developed the toolkits for the managers to use to undertake the auditing activities to identify what you've done well, what you have not done well, to identify the gaps in the quality of the care area, and to do some quality improvement activities to meet the client's needs, and while help the workforce to improve the knowledge skills and the practices in the cross-cultural care as well. The cross-cultural care program for aged care staff can be accessed through the Center for Cultural Diversity in Aging. Based on our discussion, I come up with those conclusions. And the first, a multicultural aged care workforce that reflects the client's culture and linguistic diversity is our strength. It's not the weakness. And the second, aged care organizations need to actively recruit direct care staff to match clients' culture and linguistic backgrounds to enhance the quality of the care for them to meet the care needs. And the third, managers in aged care are in an ideal position to build an inclusive environment to facilitate cross-cultural communication for staff and between staff and the clients or the client's family members. And finally, aged care organizations need to create learning environment for staff to engage peer mentoring and peer coaching in cross-cultural communication as well. We all know we've got the new stuff coming, and so the continued staff development need to incorporate the cross-cultural care content.
So Lydia, I know that in your research, you've also mentioned to us that you are recommending that organizations have a multicultural office, or like a resource person or staff as part of the management team to ensure that effective cross-cultural communication can happen. That there's like a central point of support, when it comes to mismatch or miscommunication and supporting the multicultural workforce. Would you like to elaborate a little bit? Because I know that's one of your key recommendations, and what could be the positive outcomes of that?
That sort of recommendation is from a 3 years research project funded by the Australian government between 2015 to 2018. And through that project, we worked with 2 large-sized aged care organizations and to identify issues and also identify the strategies to address those issues. One of the key recommendations from the stakeholders, particularly from the direct care works, they mention about the organization needs to have a structure and a leadership to leading the cross-cultural care, high-quality cross-cultural care, and to support the multicultural workforce development. So when they mention about the appropriate organization structure, they mention about need to have a multicultural office, and particularly for the big-sized aged care organizations, they always got the multiple sites, and they've got the residential aged care and the community aged care, and large numbers of the clients as well. If they've got the experts as the multicultural office and knowledgeable and be able to support the staff and through the organizations resources and the policy, and that will facilitate, make it easier for the staff from all the cultural backgrounds to work together to the same direction to address the inclusion and the cultural inclusion for the clients and for the staff as well. So it must have a leadership in the organization, and the organization needs to create the position and develop the resources to support that office. So that's what we get from the previous project.
You mentioned that in terms of bilingual care, we don't have a match of, for example, let's say European migrants with the same amount of European work, staff in aged care, direct aged care workforce. So there is a mismatch. You also mentioned that in Sweden there was some research done that people who have not access or cannot speak in their own language, that they may feel more socially isolated and vulnerable. So I'm just wondering, is there anything that you think that aged care organizations can do to improve that? Because we know there's a lot of seniors from multicultural backgrounds who are very isolated, and there may be only 1 or 2, from one language group. There may be obviously people where, if there's a group of people so they can sort of congregate and come together, it's a little bit easier. But what if there's only one Hungarian senior and one aged care facility? What are sort of the things that organizations could sort of think about?
Yeah, we are fortunate to live in Australia because with the multicultural communities. So, and with the efforts from the community, and we influence the policy, and the Australian government does support the community waste scheming. And if some residents and live in the aged care homes and without the staff from the same background and feel loneliness, and I think the facility can reach out to apply for the community waste scheming supported by the government to allow the volunteers and to visit the residents and on the regular basis to overcome the social isolation. That's one solution, but it's not the only one. And we do need to provide the support. We know the volunteers, they cannot be there 24/7. So, and another strategies, for example, to make the residential aged home as the residence home by put the pictures and photos and have music the residents likes in their language and from the cultural background, and or some. We've got the internet already, and we've got the social media, social platform, and use every strategy if we can to engage the residents, collect with the loved ones and the friends and the neighbors, or something. And I don't have the absolute answers, but I leave it to our audience. They are experts. They are from aged care. They may know better, and how to help the residents to overcome the social isolation.
Lily mentions the Aged Care Volunteers Visitor Scheme, who matches volunteers from specific culture or language group to, one of residents or clients. So that's a really good point. And we always recommend, aged care providers taking up that scheme. You mentioned about mentoring and peer coaching in organizations. So why do you think that's so important? And do you think that needs to come from the top, from the leadership, these sort of initiatives?
The mentoring and peer support always exist naturally in any workplace, and without any research projects or funding to support. And I think some of the staff, they mentor the new staff very well, and they do that through the empathy and sympathy. And because some of them, they experienced the difficulties in the beginning of their career. And however, if the aged care organizations has a leadership and to do the mentoring and the peer support in the active way, that will enable more staff and be mentored and supported in this situation. It's not just the mentor the new migrants from overseas. They get into the Australian aged care. They need someone to help them, to support them, to understand the workplace culture and the challenges they are facing. But for the Australian-born staff as well, and they need to be mentored to understand the clients' needs, the clients from code backgrounds, what they need, what they need, their preference, and how to meet those as well. So I think mentoring and coaching is not new to any workplace, but we need to have a leadership to use those strategies to resolve the cross-cultural communication challenges.
Thanks, Lina. I just want to mention, we had in a comment previously from Kai when we talked about what are sort of suggestions to overcome challenges. And she was saying maybe establishing diversity inclusion working groups, because I think, that sort of diversity inclusion working group or overarching diversity inclusion strategy that could link then to specific aspects in the organization, whether it's clients, whether it's workforce. And obviously, I think workforce is a really very significant issue. So that's definitely something that I think there needs to be a very targeted approach, because to supporting the culturally linguistically diverse workforce. We have a question from Kai. I was just speaking about her, so that's a coincidence. So hi, Lily. You mentioned the importance of leaders in creating inclusive workplace. How should we communicate with leaders the importance of investing and supporting our multicultural staff through organizational-wide training, resources, etc.?
Thank you. And that's a good question. And we know it's not easier to change the workplace culture, and particularly in aged care, the top-down approach in the management. And we need to promote the bottom-up policy and the bottom-up strategies, and to change the workplace culture. And I think, if most of the staff, they are aware about the inclusion and they support that sort of the inclusive policy, and they've got the power to influence the leaders and the people in the management and the leadership position. For example, our staff always got the staff meeting regularly with the management group. That's the opportunity for our staff to raise the concerns and to suggest some solutions, or the investment, resource development, what the staff want.
Obviously, aged care workforce is a huge issue at the moment at the government level. But if we look specifically at supporting a multilingual and multicultural aged care workforce, in terms of, obviously we have met, recently to discuss this topic at the center with you. What are sort of the things you think we need to recommend to government to ensure that, people from multicultural backgrounds feel safe, feel well, in their place, they feel sort of they're part of the community, and that they're understood, that, we know there's a lot of racism obviously happening as well. So I think if you had a sort of recommendation to the government, if it's sort of, in a sort of highlighting it sort of in a few words, and when it comes to multilingual workforce, do you think they need to do more research? Do you think we need more, trialing of effective models when it comes to multicultural workforce, whether it's the multicultural office you mentioned? What would you recommend?
Yeah, and thank you, Nick. That's a good question. And I've been working with the aged care industry for years already, and we've done a number of the research projects. I believe the research is one way, but not the only way to influence the policy. And based on our previous research projects, we did make the recommendations to the government, and I led the team to submit the recommendations to the Royal Commission into the aged care quality and the safety, including what you mentioned as the racism issue and the cross-culture conflicts, and how to care for the cares, how to care for our staff. Then we say them as the cares as well. And in order to recruit the new staff into the workforce, if we don't care for our workforce, how can we attract the high quality staff into the aged care workforce? And so I think we have to work strategically, and again from through the bottom up approach. And the people and our power, we hold the powers. And if more and more people are aware about the issue, bring the issue into the surface. For example, acknowledge the organization in the aged care facility in the workplace. We do have those issues, the racism or whatever the issues, and open to discuss rather than just cover it or not mention about it, and open it, bring to the surface, acknowledge there is an issue, and work together to identify the way and to address the issue. If they can within the organization, or if they cannot, and they can reach out and to the next level, or work with another organization, and or even not be the government, and to get help as well. But anyway, I think, and I do believe the bottom up approach to and the stakeholders consultations are appropriate way to acknowledge the issue and address the issue.
We really appreciate, Lily, that you share with us our insights. And we know that still it's a hot topic, as it was just put in the chat. It probably continues to be a challenge that's faced by aged care organizations and organizations in general. So we probably have to, keep discussing this issue and see what the sector can do to improve make improvement when it comes to managing and supporting a culturally diverse workforce, and making sure they feel welcome and included, and where necessarily we need to have obviously more anti-racism training as well. That's a hot topic as well, isn't it? So I thank you for the presentation, Lily.